Chapter 34, Special Senses. So your special senses are your smell, taste, vision, hearing, and equilibrium. Touch is no longer considered a special sense. It's more of a generalized one. So the nose and sense of smell. Your olfactory or your smell receptors are located in the olfactory organ, which is found up in the upper part of your nasal cavity. You have these chemoreceptors, which mean that they respond to all the chemical concentrations. Those chemicals then activate the receptors that will be dissolved in the mucus of your nose. And then that info goes to the olfactory bulb, which then in turn goes to the cerebrum for interpretation. The cerebrum interprets the info, and then it converts it into a certain smell. And then you have sensory adaptation. So this happens when the same chemical or smell receptor is activated. Your smell receptors can only be activated for a short period of time due to the fatigue of that receptor. So eventually it gets tired and you can't smell that smell anymore. So that means the smell receptors can no longer respond to that smell or odor, even if the smell is still there. This is called nose blindness. So that's kind of like we all have own smells in our home, dogs, cats. If you're living in that home for a prolonged period of time, you stop to lose the ability to smell that. Now, however, if a friend or a family member now comes into your home, they will have the ability to smell that for a little bit of time, and then eventually it will go away. And now your taste. So they are your taste buds or papillae. They're found all over the base of your tongue, and then there are some on the roof of your mouth. So your taste cells function as taste receptors, which are activated by the chemicals that we find in our food and drinks. So then those chemicals will be dissolved in the saliva, which is part of your digestive system. And then we have our different tastes. You have your sweet, salty, sour, bitter, and umami, which is the savory. And then all that chemical info is processed by the gustatory cortex in the brain for interpretation. Then your vision. So this is the outer layer. The vision actually consists of your eyes, optic nerve, which connects the eyes to the vision center of the occipital lobe. Then your outer layer, so that would be your sclera, or the white of the eyes. It's tough, and it's the outermost portion. Your cornea is that transparent layer that's in front of the eye. It's kind of the window of the eye, lets all the light in. There are not any blood vessels in the sclera. How there are many, many, many sense receptors. Then the middle layer. That is your choroid. It contains most of your eye's blood vessels. So you have the anterior part, which is the front. That is the iris, the color part of your eye. The pupil. It constricts or dilates. It constricts in bright light, and it dilates in dim light. Your ciliary body controls the shape of the eyeball. And then your lens will then focus the objects that you see. Then the inner layer, that consists of your retina, which has all the nerve cells that sense the light. You have your optic disc. That is the spot where the retina meets the optic nerve. And in this section, there are no sensory nerves, so that's kind of where you get your blind spot from. In this inner layer of your eye, you have your rods and your cones. Your rods are the objects or the function or structure that are highly sensitive to light. They function really well in dim light. They're also can be known as your night vision. Your cones are the ones that function best in bright light. They're sensitive to color, and they provide a more sharper image. Then chambers of your eye. You have your anterior chamber, which is the front. It has where the lens is, and it's filled with a watery fluid called aqueous humor. Now, what that fluid does, it kind of provides the eye with like a bath. It nourishes it with all the nutrients. It keeps the eyeball nice and moist. And then there's a condition called glaucoma. That is when you have too much accumulation of that aqueous humor. So I tried to show what a normal eye looks like, but we have too much of that aqueous humor. It starts to build up on the pressure here starts to build up, and it will eventually cause damage to the optic nerve. Then the posterior chamber. So that is behind the lens. It is filled with a solution called vitreous humor. It's thick. It looks like jelly-like fluid. It helps maintain the structure or the shape of the eyeball, and it keeps the retina flat. Then different accessory organs. You have your eye orbits and your eyebrows. They kind of form the protective shell around the eye. You have your eyelashes. Their job is to catch all the foreign substances such as dust, sweat, any kind of foreign liquid that may enter your eye. Your eyeball will close, or your eyelid will close. Eyelashes will blink to kind of catch everything. And then your eyelids, what they do, they blink to kind of prevent substances from entering your eye. And then they also kind of lubricate the eye because they have a mucous membrane that's in there that will keep your eye nice and moist as well. And then another accessory organ would be your conjunctiva. So that is a mucous membrane that kind of lines the inner surface of your eyelids. It covers the anterior portion of the eye. That mucous membrane will produce mucus, and it helps keep the surface of the eye nice and moist as well. Then your lacrimal appomatous. So that consists of your lacrimal glands and your nasolacrimal duct. Your lacrimal gland is the gland that produces your tears. They're extremely beneficial. They have enzymes in them along with water that kind of destroy any bacteria or viruses that your eye may come in contact with. And then your nasolacrimal glands, that is a gland where the tears will drain from your eye into your nose. So if you have a really hard cry, an ugly cry, sometimes you'll notice that you get a runny nose with that, and it's draining from your lacrimal duct down into your nasolacrimal duct. Then you have your extrinsic eye muscles. So your eyeball has 6 extrinsic eye muscles that are attached to the eyeball. It helps the eye move in the socket. It can move superiorly, inferiorly, which is up and down, laterally, and medially, which means from side to side. And then visual pathways. So this is kind of how you see. Your eye works like a camera. The light is reflected from an object. That light now enters the eye, passes through the cornea and pupil and lens and all the fluids. The cornea, lens, and fluids help focus that light into the retina by bending it in a process called refraction. And then that light carries an object to it, which is initially upside down. The retina converts that light into a nerve impulse, which is then transmitted to the optic nerve for interpretation, flips it back over in your brain so that you see it right side up. And then just another overview of the different functions and parts. You have your aqueous humor, which nourishes and bathes the structures of the eye. Your vitreous humor holds the retina in place and maintains the eyeball shape. Sclera protects the eye. Your cornea allows the light to enter and for refraction. The ciliary body holds the lens in place and controls the shape of the lens for focusing. The iris will control the amount of light entering, and it's also the color portion of your eye. Your lens, that is what focuses all the light onto the retina, or a process called accommodation. Your retina contains all the visual receptors. Your rods allow the vision in dim light, blacks and whites and grays. And then your cones, again, are your vision in bright light, detects color and details. And then your optic nerve carries all that visual information from cones and rods to the brain back to the occipital lobe. Now the aging eye. So what happens as you get older, the adipose tissue will start to diminish, causing your eyelids to droop. Your tears will decrease. Sometimes the cornea will or can appear yellow. Your lens becomes denser, which reduces the amount of light that is able to reach the retina, making the focusing difficult. Changes in that retina will make the vision fuzzy. Your night vision may be impaired, peripheral vision is reduced, which means your depth perception is reduced as well. And then sometimes that vitreous humor will break down, causing dark spots or line in your field of vision. Now, some common disorders of the eye. You have your astigmatisms, which is an abnormal shape of the lens or an abnormal shape of the cornea. This will have some of the things that will happen and will cause blurred images in near or distant vision. It can be congenital. And then treatment for that sometimes will be corrective lenses or LASIK surgery. Then we have your dry eye syndrome. It's the most common. It's decreased amount of oil in your tears. It's most common in aging eyes. Causes could be eye strain, cigarette smoke, age, and hormonal changes with menopause. Treatment would be, taking artificial tears, increasing your water intake, and obviously to avoid those outside irritants. Then ectotropin. So that is a version of your eyelid. So it's the eyelid is turning inside out. Causes could be aging skin, skin relaxation, or scar tissue. Treatment, if it is severely bothersome to the patient, surgery can repair the defect. Then you have endotropin. So that is inversion. That's turning outside in of the lower eyelid. Causes would be aging and or scar tissue. And this causes irritation of the sclera because the eyelashes are brushing up against it. It is extremely painful and irritant. Treatment for that would be surgery. Then you have a nystagmus. So that is your rapid involuntary eye movements. That's when your eye just kind of wiggles back and forth in its eye socket. Causes of that would be alcohol, some drugs, any ear disturbances, CVA, epilepsy. Treatment would be to focus on the underlying condition of that cause of the nystagmus. So if they can fix the condition, the eye movement will tend to slow down. Retina detachment. So that occurs when layers of the retina start to separate. This is a true medical emergency. If not treated, you will eventually lose your vision. Some of the light flashes, wavy vision, blindness, and floaters will appear. When you get treatment, there's a surgery called cryoplexy. So it's a surgery to kind of freeze the retina back onto the optic nerve or onto the actual layer around here. Now with your ears. So your ears are broken up into 3 sections. You have your external ear, which is the pinna or the earlobe auricle, and the external auditory canal. And then that canal will lead down to the tympanic membrane. The middle ear has the tympanic membrane, ossicles, and the oval window. The middle ear is connected to the throat by the eustachian tube, and that tube helps maintain pressure on both sides of your head or your ears. And then your inner ear is your semicircular canals, vestibule, and your cochlea. So I kind of did another image here. So we have your outer ear, your middle ear, your inner ear would be here. So if you see on the outer ear, you have your auditory canal, your ear flap or your earlobe. Your middle ear has all the ossicles and your oval window. And then your inner ear has all the auditory nerves, the cochlea, the semicircular canal. And then that eustachian tube, if you follow this, it will lead down into your throat. And then your hearing process. I do recommend that you guys watch this YouTube video. He does a really good job of explaining how all of the hearing process works with different fibers and fluids that are inside your ear and how they work to produce sound. Pathophysiology or conditions of the ear. So there is a thing called acoustic neuroma. So that is a benign tumor of the cranial nerve that's involved with hearing and balance. The causes can be a gene responsible for the growth of the Schwann cells is malfunctioned. Treatment, luckily tumors like this tend to grow slowly, so most of the patients will not have severe symptoms. However, if the tumor is extremely large, they will have to have surgery to remove it. And you can see the tumor right there. Another condition is called cerumen impaction. It's basically the buildup of the cerumen in your ear or the earwax. Causes can be overproduction of cerumen or improper cleaning of the ear canals, such as using Q-tips, because you're just shoving the earwax further and further, impacting it into your ear. Treatment would be an ear irrigation to remove the blockage. You can use Debrox or hydrogen peroxide. And then hearing loss. It could be also known as deafness. It is the loss of ability to hear sounds at normal level. So there are two causes: conductive hearing loss, which is the blockage of those sound waves caused by cerumen impaction, foreign body, or otosclerosis, which is hardening of that middle ear ossicles. And then sensorineural, that is damage to the actual auditory nerve. That could be from trauma, infections. And then hearing aids or cochlear implants may help with deafness. Otitis, which is inflammation of the ear. So they can be broken down again into three different parts. Otitis externa is an infection of the outer ear, most commonly called swimmer's ear. Otitis media is a middle ear infection. And then otitis interna or labyrinthitis is an infection of the inner ear. Treatment would be, considering on which one it is, antibiotics or antifungals, and then anti-inflammatory and pain medications to help with the symptoms. And then otosclerosis. So that is hardening or immobilization of the stapes inside the inner ear. It is the most common cause of conductive hearing loss. So treatment, you would have to surgically remove the old stapes with an insertion and then insert it with a prosthetic stapes. Most of the time, it will result in your hearing being restored. And then the last one, presbycusis. So that is hearing loss caused by the aging process. However, it can be caused by prolonged exposure to loud noise, infections, injuries, or some diseases. It is the loss of high-frequency sounds. Treatment for that would be hearing aids, or to no longer expose yourself to those loud noises, treat the infection. The infection was, bad enough that it damaged your ears. The hearing aid may be the only option. So that is chapter 34. Please watch the YouTube video that was posted before. It will go through how your body actually senses sounds and hearing. It goes through the equilibrium process. And that is it, guys. So thank you so much, and you guys have a great day.